Do you remember the NHS clap? In the year 2020, when the Wuhan virus pandemic hit us, Britain clapped for its health workers. In fact, it lauded the nurses working with the NHS. The country's then Prime Minister called them extraordinary. His government celebrated them as heroes. But when it came to paying them, Britain chose to give them a negligible hike, eventually leading to NHS workers walking out. It's been 2 years, the government has changed, there is a new Prime Minister, but the NHS staff is still staging walkouts. The last one being on the 1st of May, just the day after we landed here. Nurses across the country in almost half of England's hospitals were on strike. And we decided to witness the protests firsthand, just to try to understand what their demands are all about. We visited Trafalgar Square, where one such protest was underway. We also spoke to a doctor working with the NHS. Here's a detailed report. It is one of the largest employers in the world. With over 1.2 million workers across the UK, it leads the world in terms of equity of access and ensuring no financial hardship for the ill. But can the NHS say the same for its staff? Look at these images. They are from the 1st of May. These are NHS nurses and workers protesting against poor wages, seeking a pay hike from the government. We decided to visit Trafalgar Square to witness one such demonstration. And here we met Dr. Veer Pushpa Gupta, a doctor and researcher with the NHS, also a member of the Royal Society of Medicine. We asked him about the sentiment within the NHS, and here's what he told us.
Doctors that are striking are junior doctors, so basically consultant level and below, which form a majority of the workforce when it comes to hospitals and hospital staff. The nurses are striking as well, who form a majority of the workforce not only in the hospitals but also in the community. So it is the backbone of the NHS that is striking at this point. The sentiment is rather desperate in terms of how they want to be looked at. So if during Corona there was a lot of respect for doctors and nurses, people came out and clapped, people came out and showed their respect, and it was really well received by the NHS. But as soon as that finished, a lot of the staff feels like they were ignored at that point. Obviously the striking is about increasing salaries, which remain shockingly low for a Western world nation.
So what exactly are the NHS workers demanding? Two simple things. One, a 5% pay rise above inflation. And two, better working conditions for the staff. So why is the government refusing to accept these demands? Here's what we were told.
I think budgeting concerns have been an issue in not only the NHS but a lot of departments in the civil services in England and in Scotland and in Wales and all the home nations. I think that the government, the budget of the NHS is actually shockingly high. It's £280 billion, which is more than a lot of countries' GDP. So they do have a substantial budget. If the government were to pay and pay the money that the doctors and the nurses are demanding, it'll only cost them £1 billion a year out of that £280 billion.
The government's refusal to accept their demands is proving to be catastrophic. In April, 196,000 hospital appointments had to be cancelled because of the strike. In March, the strike disrupted over 175,000 appointments and procedures. And what does that tell you? That the NHS is nothing without its staff. It truly is the lifeline of the UK's health system. It has developed the status of national treasure by treating thousands of Britons free of cost, that too over 106 years. And never in its history has the NHS witnessed industrial action on such a scale. The number of protesters could increase if their demands are not met. So what is the British government planning to do? Well, last we checked, it had refused to discuss raising salaries, further raising the prospects of more strike. Bureau Report, WION World is One. WION now available in your country. Download the app now. Get all the updates on the move.